Welcome to Heart, a new podcast from the VCU Health Poly Heart Center. We're bringing this to you to talk about everything you need to know about heart health and cardiovascular health. My name is Liz Torrey. I'm the Communications Director here at Poly, and our first guest is Dr. Bhardwaj. She's Vice Chair for Cardiology here at the Poly Heart Center. So welcome.
Thank you, Liz. Thank you so much for including me in this. I think it's so important to teach about cardiovascular health.
I'm glad to hear you say that because really what we're trying to do is bring the expertise that you have and so many experts here at VCU Health and at Poly have to the general public. I am a member of the general public and I don't really know that much about heart health at the end of the day. So I want you to start at the very beginning. Can you tell me what the word cardiovascular means?
I think that's a great question, and I think it's important to start from the basics. So cardiovascular means your heart, and it also means the vessels that supply your legs, your arms, and your brain. And so we want to ensure health of your heart and those vessels. So that's why it's cardiovascular health.
So vascular is vessels.
Yes.
It's the way that the blood gets from your heart to everywhere else.
Yeah.
Okay, so can you explain to me a little bit about the structure of the heart? Like, I learned this in high school biology, but to be honest, I haven't thought much about it until I started working at the Poly Heart Center. So for all of us who have forgotten our lessons of high school.
Yeah, of course, I'm glad to. Everyone thinks the heart's really complex, but when you break it down, it actually makes sense. And so I have a heart here to show everybody. And I'm going to be pretty simple. The heart has four main chambers, and really the goal is for the blood to go from top chambers of the heart to the lower chambers of the heart, and either to the lungs or the body. And we have these tissue valves that really regulate the way the blood flows, the direction of the blood flow. So that's the heart. There's also a lot of electrical pathways here that allow for the contraction of the heart in a regulated fashion. Sometimes that goes awry, and I'm sure we're going to talk about that a little bit, but that is your simple, basic 101.
Okay, so electricity is what makes the heart beat.
Yep, there's a bunch of electrical pathways, and it really helps coordinate the contraction of the heart. And that regulated contraction is what gets blood going in the right direction at the right time.
So you just made the heart sound very simple and understandable, and thank you. But I know there's also a lot of different types of things that can go wrong with everything you described. And that is what we do here at the Poly Heart Center. We are experts in preventing heart disease, and we're also experts in treating heart disease once you may have it. So can you just talk about the different types of heart disease that we treat here?
Yeah, I'm glad to. Because the heart is so complex, there are a lot of heart issues that we treat. Our patients can be born with heart disease, so we have experts in congenital heart disease. When we talked about the electrical pathways, there could be issues with the electrical pathways, and you can get diagnoses such as atrial fibrillation. The valves of the heart can be affected, and you can have valvular heart disease, and also you can have coronary artery disease. So on average in the US, every 40 seconds someone is having a heart attack. So coronary artery disease and blockages of the coronary arteries is very important to know. Also, we have a lot of patients with cancer, and actually some of those cancer medications can affect the heart and cause heart failure, and so we have experts in cardio-oncology as well, alongside our heart failure experts.
So coronary artery disease, I feel like most people think heart disease, they think heart attack. And that sounds like what you're saying is heart attacks aren't caused by anything necessarily inside of the heart, but rather the vessels, the vascular system leading to the heart. Am I understanding that correctly?
Yeah, that's correct. There are major blood vessels that supply the heart. And if those get blockages and there's a part of the heart that doesn't get blood, then that can cause a heart attack.
Wow. So something I've learned since starting working at the Poly Heart Center is that cardiovascular disease is the leading cause of death in the world, in America, and in Virginia. I think at one time cancer was the leading cause of death, and I think maybe a lot of people still think that it is the leading cause of death, but it is heart disease, unfortunately. So I guess what I'm wondering is if you can tell me a little bit about what any of us could do to prevent ourselves from having heart disease in the first place.
Yeah, I think that's a really important question. You're right, 50% of us will have heart disease, or will be touched by someone who has heart disease. So preventive cardiology is really important. And how do you prevent heart disease? Well, you're going to try your best. You're going to eat healthy. Diet is very important, a heart healthy diet. You're going to exercise. If you smoke, stop smoking. If you have diabetes or high cholesterol, make sure you're on the right medication. medications for that. I think it's always important. People don't realize is that, oh gosh, I got to run a marathon to be heart healthy. No, you don't. Small steps. So if you're not active, just being active a little bit is going a long way. Starting is the key. So just making sure you know your lab work, making sure you partner with your doctor, making sure any symptoms you're having, you're getting looked at.
That's something I've heard some of our general cardiologists say. It's like, don't avoid going to the doctor. It's actually like, it is a form of self-care. It's almost like a luxury. Take a minute, call your general practitioner. If you don't have a general practitioner, go to a community health center, go to an urgent care, and just get a checkup. It's a really simple way to take care of yourself. And it can make all the difference in the world, especially as far as heart disease is concerned.
It really can, and I think a lot of folks are afraid. Like if they haven't had their lab work in a long time, they're afraid to see what their sugar levels are. They're afraid to see what their cholesterol is, and that's understandable. But at the end of the day, knowledge is power, and knowing your numbers is what's going to help you be more heart healthy. And you will partner with your doctor, either your primary doctor, your cardiologist, to get those numbers under control. But the key is to know what they are, know where you're starting, so you know where you need to go.
Yeah, that is a fear I definitely know firsthand, for sure.
It's like an exam. You're worried, like, am I going to get an A? Am I going to get an F, right?
Exactly, exactly. But I think the fear, knowing is always better than the limbo of not knowing. In fact, the fear is like sort of a fallacy. Know your numbers is something I also hear our doctors talk a lot about. You talk a little bit about the importance of blood pressure.
Yeah, blood pressure is really important. So hypertension is a high blood pressure. And if you have high blood pressure untreated for a long time, it can lead to strokes, it can lead to kidney failure, it can lead to heart disease and heart failure. So it's really important to monitor your blood pressure. If you need to be on medications, be on medications. Avoid salty diets, things like that. High blood pressure and hypertension are really important to take under control.
And they're not that difficult to treat, right? I mean, what I've heard is that the medications aren't super expensive.
Right. Now we have medications that aren't expensive. You do have to take medications, but and sometimes you have to take more than one. It just depends on how high your blood pressure is. But really, high blood pressure is easily treatable, and understanding that if it's untreated, it could lead to kidney failure, stroke, heart failure should be sort of a motivation to get that checked and monitored.
Yeah, and what I also know is that there's a lot of places you can get your blood pressure checked that have nothing to do with the doctor. Like you can go to CVS, you can go to Walgreens.
Yeah, and take advantage of those. If you don't have a blood pressure cuff at home, I always say, go to a store, check your blood pressure, write them down. You might go to the blood pressure a couple times a week, write them down, bring them in when you see your doctor. You'll get your blood pressure checked at your doctor's as well, but it's also important to see what is your blood pressure when you're not at your doctor's, because some of us have high blood pressure when we go see our doctor, right? Because it's like a stressful, nervous situation. So it's important to know what's your blood pressure other times of the day.
What are some specific symptoms of heart disease that you should really never ignore? I mean, I know we've already encouraged people to go to the doctor regularly, but say a new symptom crops up that someone has questions about and they want to brush it off.
Yeah, I think that's a great question as well. Everybody thinks about, if you have a heart attack, it's like an elephant sitting on your chest. You have pressure, it goes to your left arm, and those are the classic symptoms of heart attacks. But it's important to know that not everybody has those symptoms. Women, specifically elderly, or somebody who's diabetic may not have those classic symptoms. So what symptoms might they have? They may just be short of breath. They may just have jaw pain. They may just be really fatigued, really tired. So I always tell patients to look at their functional abilities. So, and monitor that. So if you were able to walk 2 blocks without problem 6 months ago, but now you can only walk 1 block, that's what we call a functional decline. Your ability to do your activities has gone down. And that, if that ever happens, you should talk to your doctor about that. If you were able to run 20 miles, but now you can only run 15 miles, wow, you're still running 15 miles, but that is a decline in what you were able to do. And so those kind of declines, when that happens, you should talk to your doctor about it, because it may not be heart disease, but it could be, and it's always better to be safe.
Yeah, for sure. And you mentioned women maybe having slightly different symptoms than men. So are there specific symptoms of any type of heart disease that women should be on the lookout for beyond functional declines?
It's good to think about that. Fatigue, extreme shortness of breath, shortness of breath. Pains in your jaw. Sometimes women may just have pain in their arm. I think the key thing is if something feels out of sorts for you, get it evaluated. If you're not able to do things normally like you were, get that evaluated, just to make sure.
So are there any misconceptions about heart health or heart disease that you wish you could just dispel in everyone?
Yeah, I think patients think, oh, I feel fine, I don't have heart disease, or there's no heart disease in my family. There's no way I could have heart disease, but you never know. And it's unfortunate that heart disease is so prevalent in our society. But just because you don't have heart disease in your family, you may not know. Your family may not know. Doesn't mean that you shouldn't get checked out. So you shouldn't have your blood pressure checked. You should do all of those things. You get your blood pressure checked, get your cholesterol checked, get your sugars checked. Just because nobody in your family has heart disease doesn't mean you don't have heart disease. So it's important to get your numbers checked.
Yeah, that makes perfect sense. And I think that's a really easy way to think about things. It's like one way of comforting yourself, right? Like, oh, it's not going to happen to me. Like, no, that doesn't happen to anyone in my family. I can see myself thinking that. So, okay, so what is the single best thing that someone listening to this today could do to benefit their heart health?
It's going to be hard for me to say one single
thing.
Sure,
of course.
But
if you had to pick one.
If I had to pick one, know your numbers. Know what your blood pressures are, what your sugars are, what your cholesterol is, because then you can target those things that need to be targeted. Don't be afraid. It is very easy to be afraid of what your numbers. You don't want to fail a test like we talked about, right? But once you know your numbers, you can tackle those numbers if they're abnormal. So go and see your doctor, get your lab work checked, and then work on the things that need to be worked on. I think if I could add one other thing, it's important. We always talk about diet and exercise, but you don't have to go start running a marathon tomorrow. Small steps are really important. So if you're not used to walking, walk a block. Walk half a block. Start small and then build up your endurance. That's really important, but start. That's the key.
Okay, so thank you for answering all of my questions about heart health and women's heart health. We just want to get to know you a little bit, so this is our lightning round of questions. So the first question is, what is your favorite way to get some exercise?
Oh, I love to play tennis. And so I don't often have time to, but if I do, I'll play tennis.
Awesome. What's your number one guilty pleasure?
Oh man. Okay, so I love to shop. So I love to shop. And I love chocolate. So we talk about heart health and but a little bit it's okay. You can cheat a little bit. So I love eating chocolate, dark chocolate.
That's great. Yeah. Isn't dark chocolate really good for your heart?
It is good, but in moderation.
Sure.
Always, but yes.
Okay. And shopping technically is a form of cardio.
That's right. And I shop fast and I run down the aisles.
That's awesome. Great. Supermarket sweep.
Yeah.
What's your favorite day of the week?
Oh, so favorite day of the week, I would say is Friday, which is probably everybody's favorite day of the week, if I'm not on call on the weekend. Friday.
Oh,
yeah.
Okay. Yeah.
Yeah.
I'm a fan of, I want you to finish the sentence, anything. Music, sports, what's your, what fan base are you a part of?
Okay, so the tennis, right? So I've been to the U.S. Open, so I love watching Wimbledon, and I love watching that. And my goal in life is to be able to go to Wimbledon, and all the major tennis tournaments in the world. So
that's a great goal. Yeah. I hope you get to do that someday. That's awesome. What's your favorite way to de-stress?
Netflix and chill. I do love watching movies. Just relaxing, getting your mind off of things. So yeah, movies.
What's your favorite movie?
Oh man, that's a tougher question. I'll give you a genre. I love action movies, because that is what helps me not think about things. Like emotional movies, sad movies, they're great, but I just want to decompress. So action, thrillers, sort of movies.
I totally get that.
Yeah.
I always want to watch action movies from the 90s. And my husband is like, can't we watch this indie Oscar nominated? I'm like, no, I want to watch Speed for the 10th time. I'm just zone out.
I love Speed. I also love Bollywood movies, but sometimes they're long. So
sure. Yeah. Okay, and final lightning round question. What do you wish more people knew about their health?
I wish people knew their lab work, honestly. I really do. Like I said, I've met so many people who are just afraid of knowing that information, and there's nothing to be afraid of, And so I just wish people would understand that just starting is key. And so knowing that I've had patients who haven't gotten their lab work in 30 years. I mean, of course, it's kind of daunting to then see what your cholesterol is, but it is very important.
Okay. Well, Dr. Bhardwaj, thank you so much for being our inaugural guest on the Heart to Heart podcast. And thanks for all the wisdom that you shared today. And thanks to everybody who has listened and watched. And we hope you'll join us again for future episodes.